our Glory Globe TV viewers, breaking news. Yes, patient of an HIV/AIDS prevention and control center in Moscow warned last month on a patient website that pharmacies in the Russian capital were no longer dispensing dolutegravir and international medicine. It is not only HIV medication that's unavailable. Patients have already reported 400 incidents of drug shortages to the Disruptions website, which monitors the availability of HIV and hepatitis treatment in Russia, wrote the independent Russian news site Novaya Gazeta Europe in November. The news site estimated that medical facilities cut procurement of almost half of all The news site estimated that medical facilities cut procurement of almost half of all HIV medicines available and stopped supplying 13 medicines completely. It's thought that more than 1.13 million people in Russia live with the human immunodeficiency virus, which can lead to acquired immunodeficiency syndromes (AIDS). The actual number is probably much higher, said Ekaterina Stepanova, a doctor at a private clinic in Russia. More than 27 regions are currently experiencing an HIV epidemic, she said. That means that more than 1% of all pregnant women test positive for HIV. That is awful. It shows just how far the virus has spread throughout Russia. Only about 52% of all registered patients received medication for free, and in exchange, they must register their status as a person infected with HIV, which is recorded in a database. Many don't want to be registered. They fear discrimination and social exclusion in Russia. AIDS is still a taboo topic. This is not only due to a lack of information but also to the prejudice associated with the virus. Many assume that only homosexual people, sex workers, and people with substance addictions can contract HIV. In society, these groups are widely stigmatized and liable to criminal prosecution. That is why working with these groups is very difficult, Dr. Stepanova told DW. Alkasroy is one of the few Russians who is forthcoming about his infection. He lives in Moscow and still remembers the day he received the diagnosis. I was 8 years old the day I learned that I had been infected since birth through my biological mother. At that time, I was in the hospital for something else and they discovered it by chance. I did not think much of it at the time. I was just a kid without any conceived notions. He lived in several foster homes until he turned 14. At first, he did not notice any discrimination due to his infection. It was only later that he realized he was being treated differently. As a child, I always wondered why my cutlery, plate and cup always went with me when I moved foster homes. I actually kind of liked it. Only later did I realize that it was because of my HIV diagnosis. He thinks, though, that this was not done out of spite but because those responsible did not know much about the virus. Bureau report, Glory Globe TV, Delhi, Bharat.